Walking on an incline treadmill is a great exercise for anyone, but there are some particular advantages if you have knee arthritis or spinal stenosis. In this video, I'm going to explain what those advantages are and how to use an incline treadmill to your advantage if you have knee arthritis or spinal stenosis. Now, let's start out with just the general benefits of walking on an incline treadmill. It burns calories, it burns fat, and that helps with weight management. And obviously, the less weight you're carrying, the less stress there is on your knee joints, and the less compression there is on your spine. But additionally, when you walk on an incline treadmill, you burn more calories per unit time than if you were walking on a flat surface. Likewise, there's less impact than if you were running, which also burns more calories, but is not great on your knees or on your back, particularly if you lack some strength in your hips. So walking on an incline treadmill is great for increasing your cardiovascular benefits, which helps improve circulation and promote healing of your cartilage in your knees and the joints and nerves in your spine. Now, walking on an incline outdoors is also great exercise, but you can't walk uphill continuously outside. Furthermore, if you get too far away from home and your knees start hurting or your back starts hurting, you don't want to get stuck out there. And finally, whenever you go up, you're going to have a corresponding downhill. So walking on an incline treadmill allows you to have a continuous upslope where you can stop whenever you need to. Additionally, you can hold on an incline treadmill, so you can take some pressure off your back or off your knees by unloading with your arms either on the side rails or on the front rails. Now, you could also do this with a walker outdoors, but again, you can't continuously walk uphill when you're outdoors using a walker. Now, another advantage of using an incline treadmill, both for your knees as well as for your back, is that it forces you to use your glutes more. If you walk on the treadmill correctly, you should be pushing yourself uphill using your trail leg, so your drive foot is the one that's coming backwards. You shouldn't be pulling forwards like this, which uses more of your hamstrings and also puts your sciatic nerve on tension when you take a long step out that way. Additionally, when you push off using your glutes, it forces you to lean forwards more, which is a better position for people with spinal stenosis because it opens up the spaces where the nerves come out of your lower back, and it also opens up the space around the spinal cord. That's one of the reasons why you often see people with spinal stenosis in the grocery store leaning over a grocery cart, because it does allow you to kind of lean forward and open up the spaces in your lower back where the nerves come out. So it is okay to hold on, particularly if you have spinal stenosis or if it helps you take some pressure off of your knees. But you want to use as little hand force as you can. If you're able to walk uphill using your arms swinging freely like that, you will probably burn more calories, but keep safety and comfort in mind, because you'll also burn more calories if you're able to walk longer and don't have to stop due to knee pain, back pain, or radiating leg pain. So use as little pressure with your hands as you need to. You can even think about it like driving a sled, where you're trying to push yourself upwards, almost driving the belt faster than it would naturally go. Now, another benefit, particularly for people with knee arthritis, is that it forces you to stretch your calves a little bit more. If you've ever used a slant board to stretch your calves, you're basically walking on a slant board the entire time. So you do get a little greater range of ankle dorsiflexion as your leg goes backwards. And you're also in a little bit of dorsiflexion with your knee bent as you hit with your front leg, which stretches your soleus, the calf muscle that doesn't cross your knee. Now, how high of an incline should you use? The incline varies from device to device, but a grade of 0 to 15 is about normal on most devices. Now, this is set at a 15 right now, and I just measured it before this video, and it measured 9.2 degrees above the horizontal. So keep in mind, these slopes aren't precise, but it's relative. So if you use the same treadmill every time, You can just progress your slope as you feel comfortable. Starting out with a modest slope of 3 to 5 is a good place for most people to start, and you can progress up from there. The higher up you go, the more difficult of a cardiovascular workout it will become, but additionally you'll also burn more calories, and it'll force you to lean forwards a little bit more, particularly if you have spinal stenosis. Now, if you can't walk on an incline treadmill, there are some other options that are good as well. Using a recumbent bike is a great cardiovascular option for both people with knee arthritis as well as spinal stenosis. And you can check those out in these videos over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.